Good evening, everyone. Welcome to tonight's discussion on the COVID-19 vaccine and health equity in our community. Our goal tonight is to have a dialogue that builds your confidence in the vaccine. I am June Collison, President of Community Hospital San Bernardino, and on behalf of Dignity Health in the Inland Empire, I would like to welcome you and thank you for spending time this evening discussing this important topic. Before we get started, I would like to share Dignity Health's vision for how we believe our ministry can help create a better and more health system. First, we believe everyone has a right to be healthy. We believe the existing healthcare system is not working and is leaving millions of people unhealthy due to socioeconomic factors beyond their control. Last, we need a more just health system that improves physical, social, and mental health through better access and more equitable outcomes. Tonight, we will have a conversation about the importance of building trust in our community. Building community trust is crucial to improving participation in COVID vaccination efforts. You may know San Bernardino County has one of the lowest COVID vaccination rates in California. To build trust, clinicians, public health officials, researchers, and trusted community leaders must develop culturally competent and transparent practices to encourage participation in our communities made vulnerable by COVID-19. Our goal today is to share facts about COVID vaccine, debunk the myths, and answer questions. Today's panel for our discussion are members of our community. We have a congressman here with us today. We have civil leaders and medical experts. I would like to introduce Dr. Victor Waters, who will lead the panel discussion as our moderator tonight. Dr. Waters is the Chief Medical Officer for Dignity Health San Bernardino Medical Center here in San Bernardino. He has over 35 years of clinical experience in both internal medicine and emergency medicine. Dr. Waters is also a JD. He also serves on the Dignity Health National Diversity Council and is a board advisor for BlackDoctorsUSA.org. Dr. Waters lectures on the importance of the COVID-19 vaccination and as a legal expert, lecture about COVID-19 liability. He has prior experiences in vaccine policies as a member of the National Foundation of Infection Diseases. You may recognize his face as he appears frequently as a healthcare consultant and COVID expert for Los Angeles area television stations, including KTLA, ABC, CBS, and Fox, among many others. Good evening, Dr. Waters. You're on mute.
Good evening, June, and thank you so much for the introduction. Good evening, everybody. This is a very, very important discussion, and we have a robust panel and a very, very interested community, including our hospital staff. So I'm delighted to be part of this. So let's go right to it. I want to introduce our panel. I'll start with the ladies first. Roz, can you introduce yourself?
Sure. I am Roz Nolan, and I'm the Chief Nurse Executive Officer at Community Hospital San Bernardino.
Thank you, Roz. Dr. Daniels.
Hi, I'm Dr. Betty Daniels. I've been in this community since 1986. I have a practice, woman-to-woman OBGYN in San Bernardino, and I'm glad to be here.
Thank you, Betty. And Sandra Rodriguez.
Good afternoon. My name is Sandra Rodriguez. I'm the Assistant Superintendent of Student Services for the San Bernardino City Unified School District and a lifelong resident of San Bernardino.
That's a great background you have, Sandra. And Vicki Lee.
Good afternoon. I'm Vicki Lee, lifelong resident of San Bernardino, homeless liaison for San Bernardino City Schools.
Thank you, Vicki. And how about Johnny Neguse?
Hi, so I'm Dr. Neguse, Johnny Neguse. I spent quite a bit of time in the area of pharmacology and pharmacy. Was a pharmacist for a long time. I'm currently practicing as an emergency room physician for the last 15 years. I'm the medical staff president at Community Hospital of San Bernardino, and I look forward to this conversation. Thank you.
Yeah, and I just have to say, Johnny, thank you, and Dr. Daniels, thank you for your service during this COVID epidemic. You were the front line. You made a difference. You saved lives, and you've seen a lot. I'm sure we're going to have more discussion about that as well. Can't help but to say that. Thank you for your service during this tough time period. Oh, let's go to Pete Aguilar, Congressman.
How's it going, Dr. Waters?
Hi, man.
Thank you guys so much. Appreciate you having me, and you'll hear a little bit more from me. But I represent the 31st District, which is entirely based in San Bernardino County, and look forward to thanking our medical professionals and first responders and sharing a little bit as well.
Thank you, Congressman. And last but not least, Pastor Owens.
Good day. I'm pastor of the New Hope Missionary Baptist Church in San Bernardino, and very pleased to be a part of this panel, as well as the collaboration that we have had with Dignity Health and health providers in the city in fighting the pandemic. So grateful that I can come to my congregation on Sunday morning and see by and large a vaccinated populace because of that collaboration. So glad to be here.
Thank you, Pastor. And I'd like to pass to you, Pastor, the baton to give our reflection.
To you, Dr. Waters, and to our host, let me first say how perilous it is to offer a Baptist preacher the mic first, because we are not much in the habit of passing the baton as much as hogging the mic. But today I will get to the point and the heart of the matter of why we're together, and do so briefly because I believe it's not a long journey to understand what the heart of the matter is. I want to frame my reflections around the theme COVID-19 and the common denominators of our humanity. COVID-19 and the common denominators of our humanity. I find that we spend a lot of time and effort highlighting our differences and our distinctives, our distinctions, the characteristics, for instance, of our ethnic identity and our social and existential experiences. We spend a lot of time saying how different we are from one another, all to emphasize why we should be divided rather than united. We've even created isms around our differences to justify how we choose to regard and treat other people. Isms like racism, classism, sexism, militarism. Well, COVID pulled the rug out from under that approach to our humanity, because it has shown no respect of persons, no respect for any of the isms that we hold dear. It is truly no respecter of persons in regards to class, race, gender, nationality, political affiliation. COVID forced us to see the common denominators of our humanity. The common response that we have had when we see grave illness in the body, the distress that we feel when we see suffering that we can't do anything about. the loss of freedom, the loss of livelihood, the loss of intimacy, the loss of mental acuity and cognition, stress and depression, loss of fellowship, the inability to breathe freely, and new targets for hate crimes on the streets. I want to say in part that appreciating our common denominators is key to uniting us and making good use of our various strengths and distinctives. Distinctive strengths such as the fact that some are strong in science and research, some are strong in spiritual counsel, some are strong in community organization, some are strong in educational enlightenment, and others are strong in the area of administrative management. These are strengths that are reflected in the assembly of the panel that we have today, and they are reflected in the treasures that we have in the human resources of our community, our nation, and the world. Combating hesitancy must be a common goal because the common denominators of our humanity remain in terms of what we are all combating and experiencing in trying to rid ourselves of this pandemic. And so it is incumbent upon us to inform, to inspire, to unite, and to organize to defeat the hesitancy and to defeat the negativity surrounding remedies and solutions to the pandemic. We have to do it as if the negativity and the hesitancy is as potent and lethal a force as the disease itself. We can do it. We will do it. Our lives depend upon it. And I, for one, am glad to be a part of the coalition for restoring not normalcy, but a newness of life that bespeaks a more universal appreciation of everyone's humanity. And may God help us all to do the same. Dr. Waters, we're in your hands.
Well said, Pastor. And really, CDC said that the greatest health crisis we have now is in health inequity. And you couldn't summarize it any better. Let me give you an overview, those who are on the call, where we're going and with this whole presentation. First, Dr. Neguse and myself is going to do a very brief summary of the data, what's out there, what's going on in our community, what do the numbers look like? And then we'll have a panel discussion. We have different areas, which makes this so unique. We all have our different passions and different expertise. So we're going to share that from a global perspective. And hopefully by 5:40, we will have a question and answer session, and you have some questions will be asked, as you heard on the orientation through the chat. I want to say that Congressman Aguilar has a hard stop at 5:30. I respect his time. So, you know, as he goes ahead and does his panel responses, if there are any questions or questions from our community, we will try to get to him as soon as possible for the 5:30 period. Is that okay, Congressman?
Yeah, absolutely.
Okay, thank you. So moving on, I just want to let's start with Dr. Neguse. We have the PowerPoint presentation. So go ahead, let's start with the first slide.
Next slide.
Next slide. Thank you.
Perfect. Thank you. So hi, everyone, and thank you so much, Dr. Waters. You know, I just want to take a couple of minutes. This slide that you're looking at is probably going to be the most powerful slide that you're going to see for tonight. I want to go over with you just the recent final report that was released just this month, actually, by the American Medical Association. So they had a very large survey trying to see how many physicians have become vaccinated in the United States. It is my opinion that physicians are best positioned to review the data, to look at the efficacy, to look at the safety, and decide whether they're going to get vaccinated or not. And as you can see here, by this final report, in an overwhelming fashion, physicians have decided to get vaccinated. 96% from this large survey showed that they were fully vaccinated. Now, the 4% that were not vaccinated, 50% of those had indicated they had plans to get vaccinated. About 64% of them got the Pfizer, 34% got Moderna, and a small percent, 2% got the J&J. Now, of the 4% that didn't get vaccinated, when they were asked why they were not, some alluded to the fact that this was fairly a new vaccine. Some said they were not sure about the long-term effects. And then when you look at whether there was a significant difference based on what specialty they were in, what region, gender, age, or race, you find that there was no significant difference at all. There was a difference, a significant difference between whether they were Hispanic or non-Hispanic, with the Hispanic at 84% and the non-Hispanic at 97%. So what's the takeaway from this? Well, the takeaway from this is physicians, again, in an overwhelming way, knowing what the efficacy and the safety profile of the vaccines are, have decided to get vaccinated. This is a big deal. There's a lot to take away from just this one slide. If you're out there and you're wondering, should I get vaccinated? Is it safe? Does it work? I'm telling you, the overwhelming majority of physicians who know the data have chosen to do so. And they have kids, they worry about their safety, and that's what they've decided. So I think this is a very, very important slide. And I'll pass it over back to Dr. Waters. Next slide, please.
And Dr. Neguse, I can't help but ask before I start my slide,
Sure.
I'm assuming you're one of the 95% or so that you got vaccinated. Can you share a little bit about the experience you've had with the vaccine?
Absolutely. So back in December, actually about over 6 months ago, I got vaccinated. I got vaccinated the very first week that it came out. So with my background of pharmacology, what I did was I took the data, the same data that was sent to the FDA, and I scrutinized it. And I'll tell you something, this is one of the safest vaccines we have ever had, safest medication vaccine that we've ever had. You will be very hard pressed to find any other medication or vaccine that came to the market with the safety data profile that this vaccine has. And what I base that on is the fact that 75,000 people were in the phase 3 trial. That's never happened before. And that happened for a good reason, Dr. Waters. Because we were moving at a fast speed, we had to prove that we were not compromising safety. And so it has the safest profile coming into the market to the public like no other. So I got vaccinated in December. The initial shot that I couldn't tell the difference. Had no effects that I could surmise. And then 2 weeks later, I got 4 weeks later, I got the second shot. And the next day I had a little bit of body aches. That lasted about a day, and then I was back to normal. 6 months later, I'm doing great. I'm still working in the emergency room, taking care of patients with a lot of confidence, knowing that I'm fully vaccinated. So I've had a great experience with it, and I would recommend it to anybody who has not gotten vaccinated.
Thank you, Dr. Neguse. Thank you so much. So and then this next slide is going to show you the main point of this slide is in San Bernardino County, those who are fully vaccinated is about 35% compared to 48%, nearly 50% in LA County, and compared to California, 47%. That's fully vaccinated. You may have heard that we're around 73%. That's for maybe just getting partially vaccinated. When you look at our community by demographics and you look at the Black community, the African American community only has a quarter vaccinated based on this data. It's only a few weeks old. It's not much different. And the Latino population is 31%. So what is critical to understand is that our community is under-vaccinated. Next slide. So much so that we have a COVID-D variant that is more infectious, can create more harm, more hospitalizations, and therefore our community, and our community of color in particular, is at risk for a resurgence, a regional, local recurrence. So we're already seeing COVID patients in our hospital, in both our hospitals, not a high number, but it's always been there, and that's a concern. So let me move on with the time we have and start with Roz Nolan, our CNO. And Roz, you have a story, both as a nurse, as African-American, and with some experience. We want to take this time to hear from you, from your perspective. Go ahead.
Absolutely. There are times when there are diseases out there, we always take the perception that it happens to other people and it does not happen to us. Well, not true, not so. I don't think there's a family or a person that has not known someone that has been impacted and affected by COVID. So just to put in perspective, I'm going to tell you my personal story. In fact, it's just a little over a year, around or about last year, 2020 in January, we started hearing the buzz about COVID coming and the need to get prepared for COVID in terms of how we were going to prepare and take care of our patients safely and effectively. And around or about February, we started getting some information where we needed to start focusing in on putting plans in place to care for that particular patient population. And in March, Community Hospital San Bernardino received their first COVID positive patient. I was actually tasked with chairing the COVID task force to make sure that we put plans in place to make sure we had isolations, we had vents, we had barriers, we had our staff educated and trained. And with that being said, everyone was moving at warp speed, including me, because we had this infection that was highly contagious and we wanted to make sure we had everything in place. So you get really busy. And so we were taking care of our patients in March. We hit our peak or our first surge, if you will, in June. And the latter part of June, over right before the 4th of July holiday, I got a sore throat. And I said to myself, I hope I am just tired and this is not happening to me, because I'm making all of these provisions to keep everyone else safe, to make sure our staff is safe. I'm making sure I'm social distancing. I am masking. I am washing my hands. I'm doing everything that I'm training everyone else to do. And the following day was right over the July 4th holidays. My throat turned in from just a sore throat to a cough. And then I was fearful because I knew better than to take my temperature, but I did nonetheless. 4th of July was on a Saturday. I took my temperature. I had an elevated temperature along with the sore throat and the cough. Returned to work was that Monday, and I called to say, I think I have COVID. And I drove down. I was tested. I went home awaiting my results. I knew what they were going to be. And when I got that wonderful phone call from the physician, it was, I am sorry, but you have COVID. And my response to him was, I knew it. I knew the signs. I knew the symptoms. I just did not want to receive it. Having said that, COVID, takes and affects people completely different. And so I thought I was a relatively healthy person. And so I was not going to be impacted. I thought if I kept breathing and I walked, I did whatever it is I was supposed to do, I was going to buy my time. So I set my calendar and I marked off my 14 days because I just knew I was going to be ready to come back to work in my 14 days. And that did not happen. During my COVID journey, I became one of those people that had incredible difficulty breathing, but I refused to come into the hospital. I refused to go to the physician's offices. I was going to push my way through this. My loving family here at Community Hospital were calling me. And there was a point in time when I would not answer the phone because I had to decide whether or not I was going to breathe or I was going to exert the extra energy to talk to them that was calling me on the phone. I will share with you. I got a phone call that said, if you don't answer this call, we're on our way up the hill to check on you because we don't know if you're living or dead. And I had to call them and say, I apologize, but I need to breathe and I can't breathe at the same time.
Roz, I'm sorry to interrupt you, but I want you to finish the story. We have a hard stop with the congressman. He's had a really tight schedule. So I'm gonna go ahead with Pete Aguilar, and I'm gonna come right back to you to finish your story. It's very important for folks to hear this, but we have a hard stop with him and I have to respect his time. I know you don't mind. Pete, I just want to, you've been a great resource. You've called me and others in the hospital system. It's been wonderful to, have the collaboration with you to give us, to ask us, what do you need as we went through this crisis? Now you have the American CARES Act and so forth. What are your thoughts with the numbers that we shared and from your roles and responsibilities? Go ahead. Your floor is yours.
Yeah, no, thanks so much, Dr. Waters. Thank you and June and Dignity and the community for hosting this. This is such an important topic. And to your point, to the slides, we have to move the needle, right? And that's why we're all here. That's what the work we want to do. But first of all, I'm so sorry, Roz. I want to hear the end of this story too. Yes. I know it has a happy ending because you're here with us and you're sharing your story and you're encouraging your community members. And there's nothing more important or impactful that you could be doing. So thank you. Votes are just about to get called here in DC. So I'm just really sorry. But I did want to say to your slides, Dr. Neguse and Dr. Waters, we've got to do better, right? We've got to do better in the Inland Empire. We've got to get closer to those LA County numbers. We've got to get closer to the California numbers. And one of the key ways we can do that is by supporting the national vaccine programs and putting more shots in arms. And that's exactly what the American Rescue Plan and President Biden have been advocating. And so, I'm pleased to be a part of that. I was pleased to support that piece of legislation. I want to make sure that people understand this vaccine is safe and effective and free. The plan also delivered funding directly to Americans in the form of stimulus checks, because we don't want people having to decide, oh, well, I better go finish my shift instead of getting this vaccine. No, we need to take the vaccine to them. But we also need to make sure we put money in people's pockets so they are taken care of. And so our community members are taken care of, because we know family members are making decisions that impact our community health. And we want to make sure that there are no financial barriers that they have to their schedule and to getting that vaccine. The bill allocated $130 billion also to our local schools, because we know that having kids in school, having students in the classroom and teachers giving instruction is one of the ways we can make our community feel better about what's going on. And so millions of dollars to every school district: Alta Loma, Chaffee, Colton, Fontana, Redlands, Rialto, San Bernardino, Upland. All of these school districts received millions of dollars. And that goal was to ensure that our school districts can have socially distant classrooms, that they can redo their air conditioning and systems inside to increase circulation in some of those older buildings, if that meant having portables, that there were no financial barriers to them doing that. I have 2 kids in local schools, and I know the past year of remote learning has been incredibly difficult for all students and parents and teachers. And so we wanted to make sure that funding was done so we can reopen at full capacity as soon as possible, which now is summer school and in the fall. And so that's just one of the lessons of the American Rescue Plan that I'm pleased to support. But I will share, just like Dr. Neguse said, and I remember this, December 19th, I got my vaccine. I got my vaccine shot very early because of the position that I hold, and making sure that there is continuity in government. And so I got my vaccine early. I had no effects. I went running that afternoon. Maybe I shouldn't have done that, but I did anyway. And then 2 weeks later, on January 7th, I got my second shot. And I felt a little bit of the chills, just like many people have, and took it easy for 24 hours. But I can tell you, and to members of the community, please, get vaccinated, get your loved ones vaccinated, work with us and tell us how to get other people vaccinated. We're willing to all chip in because we can only fully reopen, get our schools open, get our economy moving, and get our public health taken care of once we all have the vaccine. And so thank you so much for giving me the time. Roz, I'm so sorry. I want to hear the end of the story. I'm going to stick around, even if I turn my camera off. It means I'm walking to go vote. But Dr. Waters,
It's a positive ending.
Thank you guys so much to the members of the community who put this on. It really means a lot to me that you're looking out for each other, and not because you have to. I know Dr. Neguse, Dr. Waters have to. They have to care for their community because they took an oath, just like I took an oath. But for each and every one of you, thank you so much for taking the time to encourage your community members to be vaccinated so we can all be healthy together.
Thank you, Congressman. Thank you for your time and good luck. The vote. Roz, go ahead. Now we have basically 30 minutes left. We want to leave some time for question and answers. So if we can be as brief as possible answering questions in the story, let's go ahead. Go ahead, Roz.
No problem. Needless to say, I struggled during the COVID process. I was not one of those that went through it and came through it really, really easily. So long story short, for me, when I did come back to work, I still was not able to breathe. I was still on albuterol breathing treatments. And with that being said, it took me a good 6 or 7 weeks after returning to work to feel a little bit better, have my strength and have my energy back. And I was still a member of the vaccine hesitancy crew. I was one of those that says, no, I am not taking that COVID vaccine. It is too new. I do not trust it. It's not enough literature. And to top it off, I went to a provider to support my opinion, who also said it is too new. There's not enough information, and please don't take that COVID vaccine. Now, long story short, things evolve and they come full circle, and then there's more literature out there, and you find out that the COVID vaccine itself, the benefits is by far greater than what the risk is. And so not only did I take the COVID vaccine, but the provider who originally spoke to me took his before I did. And so with that being said, not only did I get the first one in November, I got the second one. I'm one of those that were fortunate enough not to have any symptoms, any side effects of the COVID vaccine. But that being said, from a personal experience and a personal struggle, when I returned to work, I actually saw death and dying at a rate that I've never seen in my whole 40 years plus in nursing. And so if I had to put a plug out there, I would by far say that receiving the COVID vaccine is by far more beneficial for families, for communities, to make sure that they get it so that they can protect themselves. There's nothing like seeing death and dying and pain secondary to something that we can contribute to preventing just by getting our vaccination. And that's my long story made short. Okay.
That's great. Thank you so much. And I know it was pretty much a challenge to go through that period. And I'm just glad that you're healthy and back. That's so important, but quite an experience to share. So, Dr. Daniels, in the you've done this for many years as an obstetrician. 30 years now? It's been 30 years.
A little bit longer than that.
A little bit longer. See that? And so the question I have, we have childbearing age women who have in the community is just hesitant because they're worried about side effects. Can you share what you've experienced again and what concerns you have in addressing that population?
Well, we've had quite a challenge with our pregnant women because, of course, when you're pregnant, you don't want to even take a Tylenol. So a lot of women have been reluctant to take the COVID vaccine. But many of the women do not realize that pregnancy, your body is actually in a immunocompromised state. So you tend to get sicker. Back when we had the H1N1 flu, if everyone remembers that, we lost quite a few of our pregnant women from that flu. And the vaccine made a big difference with that. The COVID vaccine has not been widely tested, but many other vaccines have. And so the American College of OBGYN feels that it is safe, and I have encouraged my pregnant women and breastfeeding women to take the vaccine. There's even some studies that show that the vaccine may actually give some protection for the breastfeeding infant, and they may also have some protection from the mom getting the vaccine. So it's on a daily basis, I'm encouraging the pregnant women and breastfeeding women that I take care of to take the vaccine.
Thank you. Thank you. And let's go on to Sandra Rodriguez. You deal with school issues, you deal with children, and I know there's been more recommendations for at least children under the age of 16 to 12, and hopefully later younger. What has been some of the challenges for you from that perspective?
Thank you. So we encourage all of our families to make educated decisions about what is going to work for their families. And we know that, we have lots of different beliefs when it comes to, vaccinations, but we really are pushing that our families get all the information that they need in order to make that choice. We know that we have multi-generational families that would benefit when those families make sure that they have the vaccination. Some of the challenges that we're facing is that there is a lot of fear in our schools as students are coming back. And so, questions around how will we maintain safety? How will we maintain social distancing? Lunches, riding the school buses. And so, all of those are factors, and those are things that we have to consider in order to make the educational environment suitable and safe for kids. And so we really hope that our families will weigh the option around the vaccines, because as a personal choice for me, I took the vaccine back in February. And all of my brothers and sisters, we all live here, they're teachers, they also were vaccinated, because we want to make sure that that we're not the cause of anybody else getting sick. And so, looking at big picture and looking in this community, we want to make sure that we're looking out for one another and keeping each other safe. And when we go into classrooms, while we might have social distancing, we know that kids are going to interact. And so we want to make sure that they're as safe as possible. So we're doing what we can to make sure that, all of the protocols are in place, that we're having routines for washing hands and making sure that students understand the reasons why they need to wear masks. But, we also want to make sure that we're encouraging our families to make those choices that are going to be safe for them and for their families.
Thank you, Sandra. And Vicki Lee. Vicki, I know you deal with the homeless population, and there's a lot of assumptions about homeless that maybe they're not as high risk because they're outdoors, you're not indoors, but it's a real concern with the homeless. And I'm sure you've experienced that because they're at risk for multiple other reasons on top of their medical issues, et cetera. So Vicki, go ahead and share with some of the challenges you've had, and the floor is yours.
Yes, we have students and families that are really concerned and have issues around just feeling safe with taking the vaccination. And so one of the things that we make sure that we do is give them the resources by us not being experts and able to explain to them and answer all of their questions. We have relationships with such as Dignity Health and other health partners that we refer them to that are able to answer their questions and make them feel more comfortable about the decisions that they have to make, as well as referring them to their personal physicians so that they can make informed decisions and be able to address the situation with COVID.
Thank you, Vicki. And Pastor Owens, for you, you've alluded this during your reflection, some of the challenges, and you've been proud of seeing some of your church members getting vaccinated, which is good news, but it's not really reflecting, the rest of the community. So go ahead and share, your experiences and what you think is the result of that. And I know you've done everything you can to get the word out there, but go ahead.
With us, the challenge was access. I have a more senior population. I'm 64 myself, and most of the time I'm in a meeting with people. I'm the youngest one in the room, so there was considerable vulnerability, if you will, in the populace that I serve, and they, by and large, welcome the opportunity, but they needed access because even their health providers were not providing frequent opportunities or convenient opportunities for them to be vaccinated. And so the partnership that we had with Dignity Health and Community Hospital and others in the community who trusted us because our people trust us, opened up the door wide to people being able to make appointments for vaccination or walk in if it was a mega event, because they trusted us enough that if the health providers set up their operation on our grounds in our facilities, there was a sense of trust that their fears could be allayed, if you will, by coming to where they are very familiar. So that strategy to come deeper into the community and to make use of the influence of leaders who already had the confidence and trust of the people was very important to getting to the vaccination levels that we have. I'm surprised that they are still so low, and that means that our work continues. But I continue telling our people, follow the science, not the politics and not the economics. Follow the science. And the science says that you are better off vaccinated than you are leaving yourself exposed to the lethal force of the disease, because it, as I said in my opening remarks, simply is no respecter of persons or class or any other distinction that we hold dear that makes us think we're more privileged than somebody else. And so I would like to think that our health community will continue that kind of partnership to make vaccination very accessible and on familiar grounds so that we can continue to use our influence to get people to take advantage of the convenience and the familiarity of getting it done on grounds and with persons that they already have some confidence would have their best interests at heart.
Thank you, Pastor. Now, Johnny, for you, there's a question for you. Did you get that question?
Yeah, I did see it.
I think it's relevant. It's right after, you shared. So I think it's a relative question. You want to go ahead and ask it, repeat the question and answer? Go ahead.
Well, yeah. So the question has to do with the time frame in terms of the clinical trial before the vaccine was made available to the healthcare workers. So it's a very good question. So the clinical trial actually for Pfizer, which is the very first one, well, started on July 27th of last year, and the FDA approved it on December 11th of last year. So there was about a period of maybe 4 months, a little over 4 months. But let me tell you that it was a robust safety data analyses, again, with 75,000 people with the combined Moderna and Pfizer. So it's about 4 months, which was plenty of time to do the safety data.
Yeah, Johnny, can you tell me, what it was like? Can you share with the audience? I know what your experience was like, what it was like during the COVID pandemic for you, the consequences of seeing patients in the ER. What was that experience like for you during that period?
It was horrible. It was horrible.
Yeah.
I spent a year going to work, seeing people die. I'd say probably about 70% of them were over the age of 65, but 30% of them were under the age of 65. So 30-year-old, 35-year-old, 40, 42, over and over again, they were dying right and left. 100% of the patients that get admitted into the hospital come through the ER. So we see all of them. I actually had a physician colleague, an emergency room physician colleague that died. He fought COVID the whole year. In December, started coughing. He got admitted. 2 weeks later, he was gone. First time in my life, I'm saying goodbye to patients on behalf of their family members. It was horrible. But I'll tell you, it was completely avoidable. A lot of people, too much politics, not paying attention to wearing masks, not socially distancing, not listening to the science, a lot of politics, and they end up in the ER and they die. And by the way, the ones that are dying right now, the ones that are in our hospital right now, 98% of the patients that are in the hospital right now are unvaccinated. And 99.6% of the ones that are dying right now are unvaccinated, completely preventable. So if you haven't had the vaccine yet, there's absolutely no excuse. I just encourage you, do yourself, your family, your community a favor, please go get vaccinated.
And Johnny, as a pharmacist too, as a background in pharmacy, can you explain the differences? Are there any differences between the J&J, the Pfizer, Moderna? Can you explain that? Some people are cherry picking vaccines today.
Right. And there's no reason to cherry pick between Pfizer versus Moderna and J&J. And even if we had the AstraZeneca here, it wouldn't be any difference. Let me tell you why. There's a lot of numbers that get thrown out in all these names. But at the end of the day, if you're asking me as a pharmacologist and as a physician, if there's any difference between any of them, the answer is no. Whichever one you can get today, go get it. If I had to go back actually and do it all over again, I'd probably just get the J&J myself. The reason for that is because it's one shot and you're done. And in reality, in terms of severe disease and dying, it's over 90%. So there's really no difference between any of them. The nuance of how they work and whether it's a messenger RNA versus a virus vector vaccine, none of that matters. The take home from me, for the audience, is that if you can get any of it today, go get it. Doesn't make a difference.
Thank you. So I just want to make sure people know that they can ask questions. So it's very important. We want to know what your thoughts are. We want to hear from you. And there's some questions, but let's talk about and Johnny and I can bounce that off, the new COVID variant, and does it protect against the vaccine? That's a new one that just came on, actually, that just popped up. Basically it is effective, and that's good news so far. So we need to continue it as a reason to get vaccinated. I think there's also concerns about what Johnny's referring to, some of the side effects, and that people are cherry picking, and that's a dangerous thing to do. If you get offered, you should get it. It's very important to understand. So far, there's a question whether we're going to need a booster in the fall. That's still a big question. We don't know yet. There's some studies out there saying that there's some benefits, longer term benefits. So we'll know when that comes. So that's important to understand. Dr. Neguse, any other comments to that?
No, not really. Right now, it's looking very good that for at least 1 year. But we're constantly looking at the data and how those that are vaccinated are doing with it. So
Yeah, and Roz, this is for you, and from nursing. We've seen a great number of physicians getting vaccinated, but when it comes to nurses, I've met nurses, and I would get myths. Well, it's carrying a special device to monitor us from, and that was from an African American nurse, and I says, no, that is not true. And if it wasn't for that communication engagement, she would have continued to believe that. What's your perspective with the lower vaccination rates in our hospitals from nursing standpoint? And they're frontline.
And they're still frontline. And unfortunately, as I speak now, we still have hesitancy among our nursing staff in receiving the COVID vaccination. Actually, I was looking at some information, and right now it's saying around or about 63%. And that's relatively high. Frontline nursing staff, and that's nurses, our CNAs, our LVNs, and those people that are providing direct patient care have received the vaccination. The others will not, and it's associated with what I said initially. It came out too quickly. I don't trust it. It's experimental. I want to wait for the second phase. I want to look for the outcomes. The part that's sad with that is that we are able to provide upfront accurate information. In fact, we even took pictures of various leaders taking the vaccination to let them know that this is safe and we care about their safety. They are still allegedly awaiting to see what the outcomes are going to be from those that take it in the first phase. So other than providing information, and truth be told, there's still a great disparity in information that's being shared. In fact, I was looking at a YouTube video from a body of physicians that are still saying, don't take it. So you get a body that's don't take it, and those that do take it, it's hard to decide which ones are telling the truth. And so unfortunately, some of the frontline providers are still on that bandwagon of vaccinations are not safe. And that stems before COVID, but COVID has actually expedited that because the rapidity of which it came out and the uncertainty of what the side effects are.
Oh, thank you, Roz. There's another question, and Johnny, I think Dr. Neguse, I'm going to present this to you. When do you think that the vaccine is going to become available for under 12? And they're a parent and they're hesitant at sending their children to school without vaccination. Go ahead. And we're both parents, and we feel that every day. Go ahead.
Exactly. Yeah. So there's multiple phase 2, phase 3 trials underway right now, looking at 6 months to 11 years. My suspicion is those will probably be wrapped up in about a month and a half from now. I would say in the next few months, I would say no later than September, probably October, you'll see it's going to be presented to the FDA, and then you'll see a robust outpouring of trying to get all the children vaccinated. And let me just say to whoever asked that question, I can understand your hesitancy. We spent a year in fear and tremor about this, and now to just send your kids out there unvaccinated, you think they're going to get it and they're going to get sick, and you don't want them to. So I can understand your question and your concern.
Definitely concerning. Sandra, anything? Rodriguez, any other thoughts to that matter, particularly with school children, age children?
So in our school district, we are offering virtual learning opportunities for our students whose parents believe that they're just not ready yet to send their students to school. And parents are not obligated to keep their students in the virtual academy for the whole year. Really looking at what we can do to help to soothe those concerns for our parents while still providing the best education possible for students. And once the vaccine does become available, we will partner with our resident healthcare providers to make sure that we are able to assist in the distribution of those vaccinations, as we have done at Arroyo Valley High School. It was a super site for the County Department of Public Health. And we will continue to do that and partner with our different agencies to make sure that the vaccine is available to any child whose parent wants them to get it.
Oh, thank you. We've got about 5 more minutes to the panel, and we've got a lot of questions, but I just want to make sure there is some other common questions that are out there, particularly about cardiac, the myocarditis. There is certainly concern. Whenever you hear side effects, then you get more hesitation, more distrust. This is a new side effect. Johnny, go ahead and talk about that in its relativity. Go ahead.
Yeah. So, the chances that you're going to get myocarditis from the vaccine is extremely remote. It's just like with the J&J vaccine. You remember there was a report that came out that your platelets can drop and you can get a blood clot. But that's seen 7 out of 1 million people. So similar to aspirin, which is over the counter, we don't even require a prescription for aspirin, right? You can go get aspirin and take it, and you can have a GI bleed and not do well from that. So that actually happens. I've seen it so many times in the emergency room. But that doesn't prevent you from taking aspirin. Similarly, myocarditis or any reported serious event is so remote from any of the vaccines that it's not even worth considering as a discussion.
No, thank you, Johnny. Hey, with the 3 minutes we have, I want to pass this to June Collison, our CEO, because I want to leave some time for those who don't know, she's a former Olympic champion, track star in the Olympics way back then. And not that far back, but she is a former Olympic track star. And I want to bring that up because, there's some folks really running out there now. You and I have talked about it. But I want to close it out. You've had some experiences with COVID. I want to hear your perspective as a president, and it's your show. Close it out, and thank you all for participating. I wish I could have gotten to everybody even more, but this is always a challenge. Thank you, June. Go ahead.
Yeah, first of all, I want to say there's more to come on this because our work doesn't end here. We have to continue, like the pastor said. We have more work to do, and we're going to continue these webinars until we get to where we have to get to. But my experience with COVID is that my entire family had the COVID virus. We are a family of 3, my husband, my son, and myself. And all 3 of us had COVID. So if you really reflect on that, that could have been all 3 of us not being here today.
That's right.
Luckily, God was by our sides. And my husband and my son, they had no symptoms. I struggled a little bit, some headache. But other than that, we came through well. And I tell you this, when it was my opportunity to get the virus, you would have thought I was Florence Joyner running to get the vaccine. That's how quickly I was running to get that vaccine because I believe in it. So first of all, Dr. Waters, great dialogue. Thank you, Dr. Waters, and the entire panel for sharing your knowledge. Thank you, guys.
Thank you all.
To all of you who attend tonight, thank you for your participation. I can't stress to you enough how important it is that we get more people in our community vaccinated. The vaccine will provide herd immunity and prevent other surge in the virus. And most importantly, it will protect you and your family. There are places in the community distributing the vaccine, and you heard it's free of charge. You don't have to pay for the vaccine. Our clinic at St. Bees, our urgent care, they have the vaccine. I believe so, Dr. Waters, you can correct me if I'm wrong, but I do believe they have it.
Yes.
And it is so easy to get the vaccine. All you have to do, www.myturn.california.gov. Very easy, and you can get the vaccine. Again, I thank you all for attending. I appreciate all of you, and together, let's make a difference in our community. Thanks to all of you panelists. I appreciate, and all of the participants. I do appreciate all of you. Thank you so much.
We have reached the end of our event. If you did not get the opportunity to ask your question here or have a question that arises in the future, you can email systemmeetings@commonspirit.org and we will answer your question on a future event or respond directly via email. Once again, that email address is systemmeetings@commonspirit.org. The link to the recording will be emailed to all meeting participants within the next few days. Thank you for attending.